It's 2025, and as a Latin American society, we face a ton of challenges that impact on our mental health. Climate change has not gotten any better since the 2000s. We've still got a ton of environmental issues such as deforestation and a ton of social issues as well, like poverty and inequality, in which we are internationally the first place in the world. God forbid we were first on something good. Also, there's a lot of crime and insecurity which is related to violence and drug trafficking. The government treats this as a whispered concern. The issues are endless, and I truly have a hard time thinking of sometime we had it any worse. But wait a minute. There's a COVID-19 pandemic, which is over. The only good thing about it is the fact that it's over. Latin America had one of the highest COVID-19 death rates in the world. This might have been because of the poverty conditions it faces. The article highlights that an estimated of 231 million people in Latin America were predicted to live in poverty by the end of 2020, which in my opinion was brutally fatalist because it's now 2025, and just last year it was reported that roughly 170 million lived in this condition. And I don't blame them for doing this estimation. Those were some really dark years. Like, for real. I thought it was over for us back then. The informal labor market that leads Latin America has little to no access to social protection for workers. How could they afford to stop working to quarantine properly? No wonder why that many people ended 6 feet under. Because of technology contributions to the health field, our overall health status has improved. But there are some conditions in which facing any kind of disease would make it even more rough. Like, for instance, the obese and diabetic population that recovered from COVID are not having the best time themselves. In fact, it's been studied that those conditions have a harder COVID recovery, if we could even call that a recovery. I think it's very frustrating how the governments, since the pandemic's over, have not strengthened the health sector, since it clearly has not what it takes to overcome this crisis. And it is true that health is a decision and that we can move forward to healthier lifestyle by choosing healthy habits over sedentarism and junk food. But the population that is in poverty, aka Latin America, are likely to be drawn to these behaviors because they can't afford to take care of themselves. They have to earn a living, and they use all their time and energy on that. And that is something that the government truly has a direct doing in. It is said that COVID-19 began as a health crisis, but it is now a humanitarian crisis, meaning that it disrupted lives, increased poverty and inequality. Okay, what can we do about it? What can Latin America do about these issues? It's simple, not easy whatsoever, but simple. The Latin American government should implement strategies that aim to reinforce the education system, also invest in healthcare, and promote the economic recovery of each individual. This as a whole tackles inequality, which could potentially solve a ton of issues that are social, health, or any other field really. As an individual living in these issues, we really must do something about it too. It's not only our right, but our responsibility to stay informed and educated, and support our local communities by practicing solidarity.